Hello, everyone. Thank you for joining us for day 2 of our Naturopathic Medicine Week segment. So I'm Dr. Emma Pollon-Macleod.
And I'm Dr. Yousuf Siddiqui.
Okay, and we're sitting here in our lovely brand new IV Vitamin Lounge. You can probably hear the nice spa music in the background, so we're trying to chat pretty loud.
Yeah.
So today our segment is getting to know your clinicians. So we get a lot of questions, so we're kind of trying to answer our top 3 questions that we get from our patients. So one of the first things that you've gotten a lot of questions about is Dr. Yousuf, actually, he has a background in architectural science. So people are like, how did you transition into naturopathic medicine?
Yeah, I got asked it all the time. The reason is what I'm really passionate about is helping people influence how people live their lives. And in architecture, you're creating spaces that influence how someone lives their life. Where as a naturopathic doctor, we're working on the biochemistry and we're starting to help strengthen individuals and improve their lifestyle. So they kind of go hand in hand. It seems a little abstract. Also with architecture, we're looking at like the nuts and bolts of a structure and how things piece together. And naturopathic medicine, using a functional medicine approach, does a lot of that too.
Yeah, that's such a cool, balanced view to have.
Yeah, it's kind of cool. It's really what drives me. I mean, becoming a naturopathic doctor was like a big shift for me, but it was one that was just completely organic.
Love it.
So on that note, what brought you into naturopathic medicine?
Yeah, so for me, I don't know, whoever's watching, you might have noticed I have the same last name as Kent McLeod, the owner and founder of NutriChem. So growing up, naturopathic medicine was just always talked about at the kitchen table. It's what we all used growing up. I just thought that's what everybody used as medicine.
Right.
And
how amazing is that?
I know, it was so crazy. So having constant conversations about digestive health and getting to the root cause, like that was just literally what we got brought up with doing. So it seemed really kind of a really natural progression. I always had an interest in science, so I was like, just jumped right into it. Yeah.
That's amazing. Mm-hmm. It's kind of cool that you have that. I wonder what conversations are like on a Sunday dinner at your house.
Oh my God, I know. This is all we talk about. We drank the Kool-Aid from such a young age, and we're all, my little sister is actually at school to become a naturopathic doctor as well. So it definitely runs in the family. And I guess that kind of segments us. So the kind of connection of where our practices lie, that's kind of directed my practice is through my upbringing. But have you noticed working at NutriChem, because you joined us, you've been with NutriChem for about a year now,
I have,
right?
yeah.
Okay, so is there any area in your practice that you're kind of have like a really good special focus in? Or
there is. So I would say I've been studying the healing arts for like the last 20 years through different facets and just different fields of medicine and healing. And kind of through this journey, I came to the understanding that the root of health, it's similar to actually Kent, the root of health is within our gut health. And a lot of people in North America and within our communities have really compromised digestion. So I found that the biggest gain people have is just through healing their gut. And if they can see changes in terms of, well, of course, digestion would be number one, right?
Totally.
But things like decreasing pain by decreasing inflammation in the body. We're looking at improving mood. We're looking at like the proper excretion of hormones as well. So I mean, the gut plays such a kind of a root influencer in our health that it's become a real primary focus within my clinic, as well as we're sitting in I just finished the IV shift now, as well as IV therapy. It's a big one. What about you?
Yeah, well, that kind of I know I have all these freaky, really complex cases that I've just kind of have been drawn towards me, but I also tying into your gut. It's so interesting how many people have digestive issues that just think it's completely, like they've been dealing with it for so long. Right. They think it's completely normal that they're always in pain or that they always have gas and bloating. They're like, what do you mean not everybody feels like that after they eat a meal?
Or they think it's great that they have 5 bowel movements a day. Meanwhile, it's like loose and uncomfortable and bloated cramping, right?
Exactly. exactly. And people will come to us a lot of the time and they're like, you know, one of the specialties that I have, special focus, is I do treat people with kind of complex allergy conditions. But one of the first things I always try to do in any case usually is heal the gut.
Right.
And they'll be like, well, I didn't really have that many digestive problems. But I'm like, yeah, but we need to make sure you have a robust microbiome, that your gut is functioning really well, because that is going to enhance all the other treatments that you get.
You're modulating histamine through gut health.
Exactly,
right?
exactly. So it's pretty cool. But that has been, and I guess that kind of leads into the next question that we got a lot, is what is you know, the challenges what is one of the biggest challenges that you get with your clients and your patients at NutriChem? And I think NutriChem's reputation in Ottawa, we get a lot of really, really complicated cases. At least for me, we get a lot of really complex cases of people who have seen a lot of naturopathic doctors before. They've seen a lot of other specialists. They've been to like gastroenterologists, they've been to allergists, rheumatologists, that sort of thing. And one of the biggest challenges we find is actually allowing them to be able to tolerate their treatments, because some people are so sensitive that it's actually really hard to give them any therapeutics because they react so much to everything.
Yeah, and you want somebody who understands what, like, their level of sensitivity.
Exactly.
Right?
Like if you started giving them a whole bunch of different things, they're gonna have insane reactions, and you're gonna push their healing back. So being able to understand that and understand how slow you have to go, that's definitely a challenge, but people, I think, really respect that. Do you find that with your patients as well?
I do, yeah. And then, I mean, in my first visit with all of my patients, what I talk about is that, you know, I can give them the perfect treatment plan, but it might not work for them. We have to understand kind of their narrative, their story, what their limitations are, and work with that. So in terms of hypersensitivity, in terms of lifestyle, these things are really important. One thing that I'm really passionate about, I mean, I've kind of moved my life in various different directions, always moving forward, but I'm one for you know, living my authentic self. And one thing that I truly love in my practice is helping to remove the barriers for people so they can be who they feel they are on the inside. And when you have chronic illnesses, when you have individuals like fibromyalgia or chronic infections or dysbiotic guts and IBS and whatnot, all the things that we see here, these individuals are so overwhelmed by what's going on in their body that they have a really hard time envisioning something different. And so I'd say that's one thing that really inspires me in my practice, is to watch people kind of all of a sudden develop a freedom in their body, which allows them to then look at themselves in a different way.
So amazing.
And it's totally amazing. And yeah, I love it.
Yeah, it's kind of like that saying that is like, you are not your illness.
You are not your illness.
You're not your illness, but it's so hard when you are almost people feel like they're held hostage by their body a little bit, because their mind is thinking one way and their body is just kind of spiraling out of control in another way. I see that a lot with these poor patients with really intense reactions and that sort of thing, is they cannot even begin to venture outside to be able to get back to who they really are.
Because they're scared, because you're vulnerable, right? Yeah. It's hard. Mm-hmm. And one thing that I feel that we do really well at NutriChem is we listen. So not only are we all, you know, trained and have great levels of knowledge, but we listen to what people have to say, and we work with them and wherever they're at.
Yeah, so, for sure.
Yeah.
It's funny, you hear the speakers with the radio going on. Well, I think that's a good place to end it. So if you have any more questions for us, feel free to comment in the comment section. There's going to be another Facebook Live tomorrow at 11 and another one tomorrow at 3. So make sure to stay tuned, and
we'll answer your questions.
We'll ask you more questions then. So have a great day.
Bye.
So I guess Tuesdays